You're on
Thank
mute.
you very much, Senator Stewart. I just wanted to briefly, in a couple of sentences, explain integrative medicine so people know who we are. So integrative doctors are conventional doctors, and we seek to address people's presenting condition by understanding the whole context and environment that has contributed to their overall health. And we're very patient-centred. We have a very personalised and a preventive approach. We use evidence-informed diagnostic testing and therapeutic interventions, including but not exclusively conventional protocols. And we often work in very collaborative therapeutic teams with other doctors, allied health and complementary practitioners. Our focus is really helping to prevent and reverse the kind of tsunami of chronic disease that we see today. We're now seeing chronic diseases quite early in our children, in our teenagers and in young people. And we think it's very important that we understand the context in which these diseases are developing and how we can reverse them and prevent them. We have very safe practice, low risk type of interventions. A lot of them are lifestyle focused, lifestyle changes. And we use a wide modality of practices and practitioners. At the end of 2019, beginning of 2020, we did a survey, an informal survey of 18 doctors who've been through processes, regulatory processes, to understand what was happening within our community. We noted that most of the notifications for our doctors had come from other doctors and practitioners. Very few of the ones that we interviewed came from patients. And we did, I guess, after looking at all of these and me being part of this interviewing process as well as reviewing the interviews that were done, it was very clear that a lot of our doctors were incredibly traumatised by the process for a number of reasons. And in fact, it was almost like a vicarious trauma, both interviewing and reading these interviews for me and other people who were doing this, especially because I think we belonged, well, many doctors are out there actually really trying their best and hoping that they, you know, A, never make a mistake and B, never take the patient down the wrong path. So there was in our community, there's a little bit of a sense of an ideological bias as well, because I think a lot of people don't understand what we do and make a lot of assumptions about what we are and are not doing. And that sense of bias came out in these interviews because we noticed that there was an escalation of complaints where there was no identified patient harm. There were cases in which the complaints were factually incorrect, and even after it was obvious that these were factually incorrect, there was still an escalation of the case and an escalation of the investigation. There were reviewing doctors who were usually not integrative medicine peers and really didn't understand all of what we were doing, even when they were given information and evidence about the modalities and therapeutics that we used. They still didn't accept that there was any evidence. There was often, and I've seen this a lot of what we would call maybe phishing expeditions. So there may be a complaint made. I can think of one in particular where there was a complaint made by a doctor in an emergency department about this particular doctor, and actually the complaint was false, and even the patient identified that what happened with her family had nothing to do with this doctor. But she was nevertheless investigated. They thought that they would just come in, have a look at her practice and watch her practicing and look for other problems. And this complaint went on for about 1.5 years and caused an enormous amount of stress for this doctor, who is a really exceptional evidence-based doctor. So we've seen that a lot, these kind of phishing expeditions. So yes, we haven't really found anything, but we're going to look a bit further. And if you look through any doctor's notes in great detail, of course, you're going to find bits and pieces here and there that may, not be perfect, but are probably, not worth investigating and also not really part of the original complaint anyway. There's been a lot of use of supervised practice. for doctors after these complaints have been investigated, where there has been no patient harm, and this supervision can go on for a year or a number of years. Again, the people that come and investigate, the doctors that come and investigate, are not qualified in integrative medicine, or if they identify as being qualified, are not always recognised by our community as qualified. There have been a number of doctors who've been told that they can't practice integrative medicine, that they can only practice conventional medicine, again, even when there hasn't been patient harm. And so that implies that there's inherently a problem with integrative medicine, even though there's many doctors out there, both specialists and GP specialists, who practice integrative medicine. We've noticed that there has been kind of evidence of a lack of procedural fairness, and I don't think this has just got to do with integrative doctors. It's really around timelines, and I'm sure you've heard about this, where the doctors are given, literally a couple of days to get together all their evidence. And when they've applied for an extra 1 day, for example, they've often been denied it. And this is in the same context in which it can take weeks and weeks, and sometimes months and even years, to get information back from the regulatory bodies on what's happening with their case. In these times, the doctors are often incredibly stressed. There's also a concern by practitioners about patient privacy. I know of one instance where a doctor was confronted with 3 doctors who came to witness him in consultation with his patients. That's a very stressful event, to have 3 doctors watching you. And it's also very stressful for the patients, and it's nowhere near a normal kind of consultation under those circumstances. The patient confidentiality can be an issue, especially when the files have been requested for many patients without authorisation from the patients, and there are patients who are quite distressed by that. We collected a lot of these examples that we can share with you, and they include things like suicidal ideation, marriage breakup, loss of homes, closure of practices, and again, patients being very distressed by these procedures, particularly because they are often either losing their doctor or having a doctor look after them who is, literally impaired by the amount of stress that they're under. And so we have quite a lot of examples that we're happy to share with you, but I'll just leave it at that for now. Thank you.
Okay, thank you.